All right. Welcome to the show. Today I'm joined by Dr. Bryan Denny, Associate Professor of Psychological Sciences at Rice University. Bryan's work explores how we understand and regulate our emotions and what happens in the brain and body when we do, and how these skills can be taught to improve mental and physical health. His research spans from brain imaging studies to real world interventions with people navigating grief, caregiving, and everyday stress. We'll talk about how emotion regulation really works and what the science says about training it and how it can make a real difference in people's daily lives. Bryan, thanks for being here.
Thanks so much.
Well, let's start with something simple. When someone asks you about what you research, what do you tell them?
I'm really interested in emotion regulation and have been for a long time. Emotion regulation is something we do all the time, but we don't always think about doing it. So when we want to feel something different than what we feel for any of a number of reasons, whether that's less negative emotion or potentially even more negative emotion, depending on the situation, or more or less positive emotion, emotion regulation is really essential for effective daily functioning in everybody at all developmental stages. And so that's something I've been interested in for a long time, and then thinking about the biological mechanisms for how emotion regulation happens, examining that kind of multimodally in behavior and psychophysiology and in the brain. So I self-identify several ways, but one of them is as a social cognitive neuroscientist.
So, can you share a recent moment when you used one of these emotion regulation skills and how did it help you?
You know, one time I was, and you may have some memory of this, but close to getting an NIH grant that missed by a single percentile point. And that was challenging and an opportunity for emotion regulation. We were actually in conversation at that time. Um, you said, when this is over, we can kind of get a beer and, think about it. So that was a chance to reappraise. Reappraisal is thinking about something differently. What's interesting is it's not so much, with humans, it's not so much what happens, but it's how we interpret that information. So I had to interpret that information differently, that we were close to getting the grant funded, and then on resubmission, we were able to get it funded. But sometimes you have to think about something in a different light. And one of the kind of ways I think is interesting to illustrate this, is in thinking about, what if the same bad thing happened, for example, to 10 people, right? If you were a really strict behaviorist, you would think that if the exact same bad thing happens to 10 people, they should all respond the same way. But in humans, that's not what you find. You might find 10 kind of very different types of response, even to the exact same kind of negative thing, whether it's a grant or whether it's an interpersonal conflict or any number of stressors that we can experience. And what's really interesting, I think, from a cognitive psychology standpoint, is that it's really how we interpret that information that really is central to determining how we respond to it emotionally. The same thing can happen, but it's how we think about it. It's the meaning that that information has to us. And it turns out that sometimes those meanings can be malleable.
Okay. So, this reappraisal, can you take me through sort of what that actually means? I know there's two different ways that kind of primarily one reappraises. Maybe you could walk me through what that looks like.
Yeah. I mean, I think there's at least two categories. A number of people in the field have tried to kind of break this down, and in my lab, we're also trying to do this. Two principal ways that we look at reappraising or thinking about something differently in a way that changes its emotional impact, which is a very broad statement, and you can operationalize that in a number of ways. Two ways that we've looked at a lot in my lab over the years are psychological distancing on the one hand, and reinterpretation on the other hand. And reinterpretation is a kind of more intuitive idea that people have a pretty good grasp of what that's about. That can be looking on the bright side, where you recontextualize something negative that's happened as actually not that bad. So if you got into a fender bender with your car, you could think, well, thank goodness no one was hurt. If in fact that's true.
It's
It's
like
not.
downward appraisal, what we call it.
It can be either done in two ways,
Mhm.
even within reinterpretation. You can try to neutralize the situation by saying it's not as bad as it first seemed, or you can actually positivize through reinterpretation, even if it's the goal is to ultimately feel less negative about something negative that's happened. You can even positivize through reinterpretation. In the case of if you got into a fender bender example, an example of that could be, I had scratches on my fender before. Actually, had several like dents on it. I'm going to get a brand new one.
Uh-huh.
It's going to look great.
Sure.
So this is a good thing that this has happened, even though it's not a great thing. But you feel there are positive aspects to it that you're emphasizing to yourself. Or if no one's hurt, if that's true, it's not deluding yourself, because it's only if in fact you ascertain that no one was hurt. It's emphasizing to yourself that meaning. That aspect of the situation is important to you. And in fact, maybe one of the most important features of the situation that may change how you feel about it.
Mm-hmm. And so would this be kind of parallel to when people think about sort of the silver lining
Yeah.
of a situation
Yeah.
that maybe didn't go their way?
Exactly. Right.
Okay.
And so it's something people do all the time. Right. But you're not always conscious of doing it. And so with emotion regulation, a big part of the equation is not just can you do it or can you do it ever, but can you leverage it, and in what ways can you leverage it at particular times, critical times when stressors are occurring, and for how long and in what ways. And another tactic, so that was reinterpretation, form of reappraisal. And another one that we've been interested in for a number of years is psychological distancing. And so that's a little bit less intuitive for people, we've found, but we think that it's a core component of mindfulness, of the kind of decentering component of mindfulness, where you take a stressor and appraise it in a more objective and impartial way. There are actually a few ways to implement distancing. There's kind of this atomizing aspect where we're trying to break these different cognitive constructs down into their components. And people like Kevin LaBarre recently have done great work breaking down even within psychological distancing. And so one of the ways I think that's most key in distancing is the kind of objective, impartial appraisal that you can just, instead of, and a key distinction with reinterpretation is that rather than extrapolating about what might happen, what's going to happen, that it's actually a good thing that's in the future, because once I get my new fender on there, it's going to be great. Well, the new fender's not on yet. You're extrapolating to when that day comes. You're thinking about, I will feel better in the future, et cetera, because of this kind of new context that I think of. With psychological distancing, it's not really necessary to extrapolate as much about what's going to happen, what could happen. It's more focused in the here and now, and that's one of the mindful aspects of it, that you're just focused on what is, and you're almost like a reporter taking a more third person rather than first person perspective on the stress. And that's been shown to actually be helpful if leveraged not all the time, but at particular moments. In grad school at Mount Sinai Medical School, I worked in in my postdoc. So in my postdoc at Mount Sinai Medical School, I worked in a department of psychiatry, and I worked with borderline personality disorder patients. And my advisor there said something that stuck with me about psychological distancing, that it can be useful, including in borderline personality disorder, when you feel an emotional volcano. And that distancing through that perspective-taking element of it can help you tamp down that emotional volcano in a way that may actually allow you to manage the stressor or the stressful situation more effectively. It's not about avoidance. It's about zooming into what's negative in a way that can help you do that.
Sure. That was sort of my natural sort of next question here. So when you're using this sort of techniques of distancing, how does that differ from avoidance, which we're, told time and time again for good reason is typically one of the universal bad strategies one can utilize?
Well, particularly if the stressor is likely to recur, particularly, avoidance is not a good idea. Absolutely, it's not avoidance. Imagine that you're an EMT, for example, and you come up on a pretty distressing scene where you're called upon to help someone, but there's somebody is very badly injured and there's a lot of blood, if you're employing psychological distancing in that moment, and it's important, I think crucial to say that, the sort of emotion regulation training that we do, we never train people to apply one strategy all the time. We think of it as a tool in the bag to bring out when it might be at an adaptive time. And if you're in an EMT and you're coming at a very distressing situation, you're coming up and you have a goal to help someone. Through using something like psychological distancing, you can more objectively and impartially appraise what needs to be done. That appraisal is going to entail you engaging with the emotionally evocative aspects of the situation, including all the blood and all of the other very distressing features of the situation that are present. But you have to be present and engaging with those, in fact, to help someone
Mm-hmm.
more effectively, because you're taking a more third-person perspective, leaning out from, how horrible this is and into, this is what it is. This person has a wound that needs to be stabilized. We need to carefully get them on the gurney. We need to help them. So you're engaging with all of the distressing and emotionally evocative aspects of the situation, but you're doing it in a more objective and impartial way.
So implicitly, in sort of what I'm hearing, and it was actually borderline explicit in one of your descriptions, is that there are certain circumstances when maybe reinterpretation would have a lot more utility, but others where it may not have any utility,
Yeah.
and distancing would be a much more powerful strategy or rational strategy.
Absolutely. Or maybe it might work, but not as a good of a fit as another strategy. And we're trying to test models in my lab, building that out. That's actually not as clear in the literature, that which strategy might you want to leverage at which particular time, and for which person as well, because there may be important individual differences between people that may also predict which strategies may be best fit in which situations. And so we're trying to build that out and test that now. The more avoidance-based strategies may actually be adaptive in the circumstances where you really don't need to engage with the stressor anymore. You can really leave the situation. One of the examples I talk about with my students a lot is, we think a lot about reappraisal in my lab, but I'm teaching an emotion regulation seminar right now. I try to emphasize that I really don't think that there's any hierarchy of emotion regulation strategies. I don't think that there's a good, better, best. I think it's about best fit and having testable models where you can postulate which strategies may be good fits for which people in which situations. And one of the examples of a time, I think, that reappraisal, which we think about so much in my lab, may be a really poor fit. One kind of paradigmatic example is, what if you're in an abusive relationship? If you're in an abusive relationship, using reappraisal, thinking differently about these stressors in a way that recontextualizes their meaning, may not be a good situation at all if you're truly being abused, and if you have hopefully the chance to extricate yourself from that situation, to truly leave the situation if it's truly abusive. So in that case, finding a way to kind of exit the situation entirely may be highly adaptive. But I think it really depends on the stressor, and maybe certainly on different other kind of person factors that we that we kind of look at. Personality variables, but also perhaps cultural variables, other kind of individual differences that might predict which strategies might be best for which people in which situations.
That actually makes a lot of sense. When, I've taught before in different psychology classes, just cognitive behavioral framework, CBT framework. One of the things that immediately comes up to the students is this idea that not in all situations is you feeling badly because of some sort of distortion. So if we think about the cognitive behavioral model, you have this activating event, right, of some sort, right, the stressor that comes up. And the idea is that we're interpreting the stressor in a way that if we could change that interpretation, reinterpret, target that distortion, we would feel better. But there's many cases where it's just bad, right?
Yeah, and I think one of the factors in the model that we're building out is how likely it is to recur, in addition to the intensity of the stimulus itself. And I think one of the illustrations of that, we got some data reasonably recently in the lab. We're running other emotion regulation studies now and other kind of stress population, but we ran an observational study, which I know is near and dear to your heart. We're trying to do more of those as well. But we did it during COVID, and we did an observational study of what sort of emotion regulation strategies people were using and to what extent, and then how stressed were they feeling about the pandemic overall. And we just did a robust regression. And the only strategy that was associated with lower COVID-related stress was distancing, and reinterpretation was a null effect.
So what do you mean by null effect?
The extent to which people reinterpreted, and we gave them examples of what that would mean during COVID, was not related to more or less pandemic-related stress that they're experiencing. So the way that we kind of gave them examples of that, in the instructions for reinterpretation was thinking about how, to what extent have you thought that COVID is going to get better pretty soon?
Okay.
The pandemic is going to get better. I mean, eventually it's going to pass. And so the example for distancing was more about, to what extent have you thought about COVID as a natural biological process? And so it's the latter that was more associated. The more that people did that, the lower their pandemic-related stress. But the more that, and by the way, we gave other emotion regulation strategies as well, including avoidance-based strategies that many people probably didn't have access really to use, suppression strategies that really spanned this whole process model of emotion regulation developed by James Gross at Stanford. And throughout the entire process model, the only strategy that was associated with lower pandemic-related stress was distancing. We think that reinterpretation wasn't, because to the extent that, and we did this in April of 2020, to the extent you were thinking, oh, it's going to be over soon, it's going to get better soon, nobody knew in April of 2020 when this thing was going to get better. And it turned out that it was a kind of a long time prior to that happening. I think that illustrates something else too, is that reappraisal, it's not about delusion. It's about, for what you can feel confident is true, emphasizing those aspects that you do in fact believe are true, and then increasing the meaning of those aspects to yourself. But unfortunately, in the beginning of COVID, for most people that were looking into what was said and everything that was being written about it, the light at the end of the tunnel, you had a vague sense that it was coming, but it's more opaque to really see exactly when it was going to get better. And we think there are lots of other kind of stressful situations that are like that as well, where extrapolating for how it's going to get better, when it's going to get better, to what extent it's going to get better, may be a little bit more difficult or a little more opaque. And in those sort of circumstances where it's very likely to recur and the intensity is pretty high, we're thinking that distancing might have a shot of being a tool in the bag that you might want to have.
Are there certain people that are just naturally better at emotion regulation than others?
Sure.
And how would you even define better?
There's a number of ways you can think about emotion regulation success. One of the clearest ways that I was kind of taught to have as really the ground truth is the experiential kind of component of asking someone to self-report on their emotions. But there are limitations to that. There is individual difference in the extent to which people can really introspect on what they're feeling in a given moment. There's a psychological disorder, alexithymia, where people actually have difficulty accurately introspecting on what they are actually feeling, but that's a spectrum. So I think there's no question that some people are able to do this very, very well, vis-a-vis their emotion self-reports and vis-a-vis other indices that we try to look for converging patterns of evidence among. So not only their emotion self-reports, which of course may be susceptible to what we call experimental demand, which is that if you think that you have some expectation of what the researcher is hypothesizing or what they quote unquote want. One of the kind of bases of social and affective neuroscience is that we don't just want to study what people self-report, although that's really, really important, but for several reasons, and principally including understanding the basic biological mechanism. We want to measure these biological variables as well that are less susceptible to experimental demand and see if they are showing patterns that cohere with what we're seeing with the self-reports.
Uh-huh.
And certainly some people have more facility with this and some people have less. In some of the studies that we're doing, we're really trying to target it to people who are experiencing particularly significant amounts of stress, where having additional instruction in certain types of emotion regulation strategies might be helpful, and we're trying to measure that and assess that.
So I want to go to that in a minute. Before, I wanted to focus just a little bit more on this notion that some people may be better at it
Yeah.
naturally than others.
Yeah.
Are they better at it because they picked the right strategy at the right time? Or are they better at it because whatever strategy they're utilizing that strategy more effectively or more, kind of precisely in a way that was sort of adaptive?
Yeah.
Because I could see it being either or both. Yeah.
Yeah, it's a really good question. I think that ultimately it's both. A lot of people in the field have thought of this as kind of a capacity and tendency question. And a lot of the most widely used measures that we have for measuring emotion regulation are really more tendency measures. How often do you and to what extent do you engage in particular emotion regulation strategies? But there are also ways to assess the efficacy of when you do employ those strategies, how well does it go? And one of the kind of more recent things that's really taken off in the field is doing more ecologically valid work. They're experience sampling studies where you can not just examine these emotion regulation constructs in the lab, which is really important, and there's certain types of biological data that you can get in the lab, but then also measuring them outside of the lab in people's daily lives. And I think that's really important too. And some of the things that are coming out of that work is making it even easier to and more feasible to assess how over the course of someone's daily life in a real day, what strategies they're using and how much they're switching among those strategies. And so then you can look at not just kind of how much are people using certain strategies and how effective are they at those strategies, but how are they mixing them and switching them over the course of the day vis-a-vis the stressors that they're experiencing. And there's absolutely kind of variation among people in how fluidly they can do that. And we're interested in that, as well as whether through training people may be able to engage in some more adaptive patterns.
So can you tell me a little bit about the studies that you've done training people to utilize certain emotional regulation strategies?
Sure.
I know you've done work in bereavement and also in doing right now in sort of the dementia caregiving space. Can you tell me a little more about sort of how you teach them and what the results are?
Absolutely. Have been really interested in this for a while. In grad school, I was really energized to learn, in the sense that it was an opportunity to try to learn more about that. We really needed to learn more about how people could learn single emotion regulation strategies. There are large and very valuable psychotherapy literatures based on psychotherapies that are really multi-componential. They're heterogeneous, and I think it makes sense that they are, because I think you want to start with evidence-based psychotherapies with which collections of strategies do we think are likely to be helpful and adaptive for somebody, and use that as an intervention for people who may really need intervention, and then assess if they get better. And I think that is not only valid to look at beforehand and now, and I think it's going to continue to be valid to look at that. And various forms of cognitive behavioral therapy. In my postdoc, I received training in dialectical behavior therapy with borderline patients. There are many types of psychotherapy that have been shown in an evidence-based way to be very helpful and are manualized. But what's interesting is they're really multi-componential. So lots of different emotion regulation strategies are trained. So it's a separate kind of question. I think it's an additional window into additional research that can be done, and this is something that's really animated a lot of the work that I've done in my lab since I was in grad school, is if somebody gets better because of a course of training in one of these more multi-componential psychotherapies, why did they get better? What really drove them? What drove the benefits? Were all of the strategies kind of equally helpful? Were there some that were more helpful in some situations than others? That's not really the primary question that's been driving a lot of that work, but I think that's a question that's interesting to ask, because a lot of existing psychotherapies take a fair amount of time to deliver necessarily. And a lot of them involve, again, I think for very good reasons, contact with a therapist directly. And consequently, they're a lot of times a little bit expensive, maybe poorly covered by insurance, hard for a lot of people to access them. But one of the things that I think is this interesting, potential for additional work is there may be additional people that may be able to benefit from emotion regulation interventions beyond those that may really benefit from a intensive heterogeneous intervention. I think that there's always going to be a very valid place for that. So I think the research that's happened is super valuable, including the way that it's informed clinical practice, which I think absolutely has its place and is continuing to help people. I think there's a way that we could look at shorter courses of training using particular strategies, which was less examined when I was in grad school.
So what would that look like? Or what does that look like in your lab when you're sort of teaching one of these strategies?
Yeah. When we first set it up, when I was working with Kevin Oxner at Columbia and also collaborating with Leila Devachi, who was at NYU at the time, we looked to the episodic memory literature, to really determine how we would space out the sessions. And so we, in the original studies, which I've eventually carried forward in different variations to Rice, have a week or two using 4 or 5 sessions over 1 or 2 weeks of a kind of shorter format training that you can have with a trained experimenter who's not necessarily trained to the level of a clinician, but someone who, and again, this may not be appropriate for everybody, including people that may profit from more kind of intensive clinical intervention. We wanted experimentally to look at this first in healthy adults, in healthy younger adults. That's the first population that we looked at. And we trained people in distancing and reinterpretation separately in a between group way. And we also had a group.
And how do you do that? Like, how would you train someone? Like, maybe you can walk me through. How do you train someone in reinterpretation?
Yeah, we did it with image examples. So people would, in this case, kind of the original studies we did were kind of in-lab based, and people would come into the lab and sit down at a computer with an experimenter, and they'd be walked through an emotion regulation strategy from a script, and then they would be presented with different emotional images. And they would be, after they had had the explanation of the strategy, they would be asked to self-generate reappraisals using either distancing or reinterpretation appropriate to that image. And so I did the first few of these, and one of the first participants I ever ran for this said something that really stuck with me. I always remember. And so he was a little bit older, and he said to me after I'd finished the training, "I really appreciate everything that you said, and I'm going to try to do the task in good faith. So I appreciate all the training that you've given, but I just want to let you know that it's less relevant for me because I can turn my emotions on and off like a light switch."
Mm. And what were your sort of thoughts on that from a kind of a scientific perspective, knowing what you know about the emotion regulation literature?
Well, in the moment, didn't really know what to say. Thank you so much for doing the task. But I knew that that was not really consistent with the literature on emotion, that when you feel something, it can set off these cascades within you that really don't operate, super fast timescale, certainly not like a light switch. So sometimes when emotion starts, it can take a little bit of time to fall and to fade away. So it may not be extending over a very long time scale, but usually for most people not operating like a light switch at all.
Mm-hmm. So you bring them in the lab if you're teaching, or if you're just teaching someone in general. It can be in the lab or it could be right here. You show them a picture, you said.
Mm-hmm.
Is this an emotionally salient picture?
Mm-hmm.
Is it relevant to their own lives, or is it sort of is it more sort of generic?
That's a great question. We've actually kind of done it both ways.
Mm-hmm.
And we want to have it be, the psychological term is ecologically valid, which
Mm-hmm.
is, it just means exactly what you said, relevant to someone's daily life.
Mm-hmm.
The trickier thing that we originally did it with the younger kind of healthy adults was, well, what's, negative things that are relevant to them? And so in the kind of original studies that we ran, they were more generic, higher arousal, negative scenes from standardized emotional picture banks. There are standardized emotional picture banks.
Mm-hmm.
And so we selected images from that were a mixture of social and non-social negative images. But in later work, when we worked with more specific populations, we tried to make the stimuli more specifically relevant to those contexts of those populations.
And you ask them to reinterpret the picture, and the idea is you're training them through this sort of process to reinterpret in general. So in their everyday lives, when something comes up that could elicit a real sort of negative emotion, they're to harken back to the skills they learned in sort of that session to reinterpret. Is that what I'm hearing?
That was the more implicit idea. We didn't make that explicit to them.
Okay.
In that study. In later work and some additional work I'm collaborating on with people at Mount Sinai and borderline patients, we're making that connection experimentally more explicit. But in this original work, we left that to be more implicit. We didn't want people in that study to as directly tie what they were receiving to be training per se, because we wanted to minimize the experimental demand as much as we could. And we gave them validated questionnaire measures for example, perceived stress outside of the lab. And that's one of the reasons that we didn't want to make it so explicit, because we wanted to see, is this having an effect on the perceived stress that people have outside of the lab, hopefully with a minimum of their thinking about the direct connection to whatever we may be interested in within the training that's going on inside of the lab. But one of the other things that helped us with that is that to the extent that there was, experimental demand that people experienced, it should have been equivalent across the different groups, because it was between group. And then we did see in the initial study that it was only training in psychological distancing that was associated or led to lower perceived stress in daily life and not reinterpretation.
And do you think that is because it's easier to, even if it's at a implicit level, teach one to distance?
Yeah.
Or do you think that's because it's more effective in general?
I think it may be some combination of both. What we found was that not only outside of the lab that there was this effect specific to distancing, but when you got training in distancing for emotion regulation trials, when you did an image-based task in the lab after you finished the training, when images came up and you were just instructed to look and respond naturally, what was looking and responding naturally changed over time for people in the distancing group. That not only did their self-reported negative emotion diminish when they were cued to use reappraisal, which it did for distancing and for reinterpretation, but for distancing in particular, there was also a drop in the self-reported negative emotion, even for trials where you were presented with a negative image and not instructed to regulate. And you could think, is that just a habituation effect? People are seeing negative images over and over than you saw for reinterpretation. And it was much more than you saw for a third group that we had in that original study that just looked at all of the negative pictures without engaging any emotion regulation at all. And over the course of the 4 sessions, they didn't show much movement at all in those unregulated trials. So it looked like it was not just habituation, but that people are really appraising stimuli naturally differently. And what we thought of or called it was getting into more of a mindset that you could apply. Not that you would kind of do that absolutely all the time, but that it would be easier to engage in objective, impartial frame of mind when appropriate. Negative situations come up, and not to suggest that that would be the only kind of sum total of everything that you could do, but it could be one way to engage with, and I think it really is engaging with negative things that happen in a way that makes them a little bit less overwhelming.
Hmm. So, one of sort of the challenges of childhood, and I would say a major challenge of parents raising kids, is in a way teaching them to regulate their emotions, right? Enters this world, of course, that comes from sort of soothing and sort of based on sort of a bond with most of a maternal figure. And then our hope is over time, one learns to regulate their emotions without that sort of kind of immediate support of someone else. These techniques that you've kind of talked about here, just in general, teaching sort of reinterpretation, teaching distancing, I'm sorry, teaching reappraisal, teaching distancing. Is there sort of a certain age when it's possible to start doing that? Because most of the literature I'm aware of when it comes to younger children is it's much easier to focus the level of behavior, positive and negative reinforcement,
Yeah.
before you start to get into things like appraisal. So I'm curious, from your standpoint, from your literature
Yeah.
standpoint, what's sort of the developmental trajectory of when you can start teaching these skills to kids developmentally?
Yeah, I think that's a great question. I'm collaborating with a researcher at UCLA that I went to grad school with, Jen Silvers, on looking at emotion regulation training in different kind of developmental critical periods, children, adolescents, and young adults. And I think that that's a really good question. I think that the jury is not completely in on that, that there's with kind of age appropriate ways of training the emotion regulation strategies, we may see that particularly in older children and in adolescents that it may be a particularly profitable time to train emotion regulation skills. But I think we need to look into that more fully. I've talked to Jen about this. I have a 6-year-old, but I haven't been brave enough to run kids in a study. And Jen has reinforced you have to be brave. So I admire her bravery. But I think that clearly looking at training at younger ages could be particularly important. There's a lot of thought about training with the delay of gratification kind of literature and how that could be really useful for emotion regulation. But, that's some people may be familiar with the delay of gratification literature is the famous marshmallow test, where in kids, if you have one thing, but if you wait a little while, you can get more of what you want, 2 marshmallows instead of 1. And there's interest in kind of training the ability to delay gratification as something that can be very useful for somebody, and using emotion regulation skills as one way to increase your ability to delay. I think the jury is kind of more of the kind of amazing predictive power of the delay time that kids have. And this is not work that I've directly been involved with, but know about, that predicts all kinds of things decades down the
Mm-hmm.
road. It's less clear it's particularly the delay time that's one of the key drivers of that. So that if you manipulated the delay time, it's not so clear that that would change the kind of more distal
Mm-hmm.
outcomes. But I think it's really interesting to think about both kind of self-regulation of, appetitive or positive stimuli that you might want to be able to wait more for, as well as other kinds of emotion regulation where you may want to manage stressors and negative things that are happening, including in critical developmental ages, I think are both really important
Mm-hmm.
kind of areas to continue research.
In addition to sort of this developmental question, what about cross culturally? Do we see kind of this sort of pattern of emotion regulation processes and their adaptive utility being something sort of universal in being human? Or is there really cultural nuances to the how the process unfolds, and also maybe the efficacy of
Yeah.
one strategy versus another?
I think culture plays a really important role, and I think research is starting to flesh that out a bit more. What's helpful in one cultural context may, as a general matter, be not as helpful in another cultural context, or not as harmful or deleterious in general. There's research on something called expressive suppression, which is another form of emotion regulation,
And what is that?
where, for example, if something negative is happening and you want to feel less negative about it, that you expressively suppress by just trying to show a poker face, right? And there's a lot of literature to suggest that that may kind of increase kind of more maladaptive physiological reaction that you can have when you expressively suppress. And so the shorthand is, oh, well, expressive suppression is bad, but that's not so clear in a couple ways. First of all, I think it's really situationally dependent. You know, if anyone is in a card game and you're holding four aces, in that moment, using expressive suppression may be a very adaptive emotion regulation strategy to use. But also not just situationally dependent in that way, but also dependent on person factors like culture. There's evidence to suggest that in East Asian cultures that the impact of utilizing expressive suppression may be less in general negative relative to European American context. And so I think that that's really important to kind of take account of.
Is there
And
any kind of speculation of why that would be?
the kind of emotion goals, or sometimes it's called ideal affect, is different culturally. And the ideal affect that someone is kind of working toward can differ in important ways cross-culturally. Jeannie Tsai, for example, at Stanford, has done great work on this. And so I think that there's a lot more research to be done to understand that in these models that we're building out, what is the role of culture, and not just a few cultures, but looking at many different cultural contexts around the world, how which strategy may be best fit for which situation may be critically dependent on interaction with culture.
Interesting. Interesting. You've done work in neuroscience looking at people's brains under fMRI machines while they're engaged in certain emotion regulation tasks. I'm curious how the fMRI work has informed the way you think about emotion regulation, how it's what it's taught you beyond, this part of the brain does X and this
Yeah.
part of the brain does Y in a situation.
Yeah, it's really near and dear to my heart. The brain is not very modular, especially in these kind of higher cognitive areas. It's less about mapping that this region does X, but how is the brain in concert with other areas of the brain? How does the brain function together in different areas, and different neurons within the brain functionally interconnected with others in ways that subserve our entire life, all of our emotional life, all the things that we think, all the emotions that we feel, the behaviors that we engage in, all have, as a kind of mechanistic root, these really complex operations in the brain. And I'm incredibly fascinated by that, animated by that. I'll give you one example that really, I think, is so exciting right now. And that's thinking about brain mechanisms for psychopathology. The way that we diagnose psychopathology today is less informed by neurobiological mechanism, because we still have to find out what those neurobiological mechanisms are. I think it makes perfect sense. It's very sensible, and it's helping people for why we are diagnosing and treating psychopathology today the way that we do. But we don't understand the underlying mechanisms.
Mm-hmm.
And I think that you could look at that in, if you pardon the kind of reappraisal way, in a glass half full or glass half empty way, right? But I think that it's really glass half full in the sense that there's so much to learn, and we're helping people now with interventions for all different types of mental disorders. But we're going to, I think, be able to help people even more in the future as we understand more of the kind of underlying fundamental mechanisms in the brain. And this is interesting to me because I think that we're going to see more and more that it's gradiential in the way that it's organized, and not just like kind of on a single dimension, but on lots of different interacting dimensions that are being elucidated more so now that really form the psychological basis and the biological basis of psychopathology in general. I think it's going to be really fascinating to see how our current kind of system for thinking about what a mental disorder is going to change in a way that I think is going to encompass much more kind of what today is thought of as subclinical presentation of mental disorders. And the entire kind of spectrum between clinical and not. I think there will always be a place for kind of intensive intervention if you need it, and that will always be there. But I think that thinking about mechanisms, to what extent is there sharedness in the mechanisms between how people regulate emotions that are otherwise healthy, and what extent is there similarity in mechanism that somebody that has diagnosed with borderline personality disorder or major depression, the brain can really not only just tell us, oh, what regions of the brain are important for leveraging or implementing reappraisal.
Mm-hmm.
It can really help us answer these very deep questions about what emotion is and what psychopathology is.
So to make the sort of connection to emotion regulation and psychopathology, would you have someone, are you saying you'd have someone do some type of emotion regulation task under the scanner, and you would actually, by seeing sort of how the brain operates sort of in real time under this sort of strategy they're trying to employ,
Yeah.
you would be able to kind of better make a diagnosis in much the same way that a physician might have a physical test that they have someone employ to make a diagnosis over just sort of observing something from the
Yeah.
abstract.
A biomarker, I think biomarkers will be developed. There are very few biomarkers today that you can really point to, especially particularly for mood and anxiety and personality disorders. They really don't exist. And so I think that those are coming. And so, yeah, we've done a lot of work in my lab, putting people in an fMRI scanner and then asking them to complete an emotion regulation task, and then doing that longitudinally, for example, in between getting emotion regulation training in between, and then seeing how their brain activity patterns change as a function of getting emotion regulation training. And I think that that can tell us a number of things, especially if we look at this transdiagnostically in a number of different populations. Broadly, I'm interested in contributing to this idea of ultimately thinking about how our kind of taxonomy and nosology for psychopathology may change, ultimately. But it can also give us information about what might be the best targets for intervention.
Mm-hmm.
So there's a basic science reason to do it, to try to understand, for example, the kind of nature of psychopathology more, and emotion as well, which is not to say that it's not reductionistic. I mean, it's still, the feeling of an emotion is still kind of a qualitatively different level of analysis than the brain activity patterns. But those brain activity patterns can still help us try to understand how this really comes to happen. And that is really useful from a basic science level, but then also from a translational level in suggesting networks to target for intervention. Whole networks, or maybe nodes within those networks, that we may be able to target with psychotherapy of any number of different forms, or psychopharmacology, or directly with neurostimulation that may be informed critically by neuroimaging studies suggesting different networks that you might want to target. So it may be useful both from a kind of basic science understanding of how we regulate our emotions, how different people do that who vary in how they experience negative emotions, thinking about how psychopathology is really organized, both clinically and kind of subclinically, or in a spectrum toward what's today thought of as just healthy, as well as suggesting targets for intervention. I think that the future is really exciting with that.
And speaking of interventions and translation, your newest work is using smartphone technology to teach people emotion regulation techniques and reinforce those techniques. in dementia spousal caregivers. What exactly are you doing there?
Yeah. This is work we're collaborating on, but I appreciate your. So we're really interested in how people are able to learn emotion regulation strategies, not just in the lab, but also outside of the lab. So a population like family caregivers of persons with dementia is a very, very stressful experience to begin with. And we're actually looking at those caregivers who are having a particularly stressful experience in that caregiving role. And we're really interested to see if in some of the earlier studies we were talking about when we were training the emotion regulation and bringing people into the lab, can we actually do that when they never come into a lab at all? And can they get that training that we were thinking of where they came in, they did it at a computer? Can they actually just do that with their smartphone with little snippets, a kind of shorter format? Because it would take 10 minutes to train somebody in the computer-based way, and then another 20 minutes to do a task. Could we shorten all of that to be more appropriate for someone who may be experiencing more stress as a caregiver, and then just give them some daily practice that's in taking only a few minutes to do in either distancing or reinterpretation, and then see if to what extent that's helpful to them, and also thinking about what changes that may have in their psychophysiology as well. So we're mailing them chest bands to measure their heart rate variability as well. So try to get some handle on a psychophysiological or biobehavioral index there as well. And then sampling their emotions at random intervals later in the day to see how people are feeling after they have gotten this smartphone-based emotion regulation training, to get what they call ecologically valid, or something that is an emotion report that people are really giving as they're going through their daily life with just a brief check-in. And so we're in the process of doing that. We're about 60% done with this study, and we're really excited to see what we'll find.
So this is something that could sort of potentially be an app that everybody could be developed someday and utilize broadly to sort of teach people how to regulate their emotions. Is that kind of the idea?
Absolutely. When I was a postdoc and I gave a talk about some of this emotion regulation training work, and the chair of the psychiatry department at Mount Sinai was there, and I said, we're not really thinking of this as its own kind of therapy ever. I mean, maybe it could be an adjunct, or it could
Mhm.
provide, but we're not thinking about it that it could be its kind of own intervention. And she said, why not? So anyway, after that, I tried to, okay, well, maybe
Yeah.
it's, but, I think it could be an adjunct to potentially augment other types of therapy that somebody is getting, or it might be this, shorter, more targeted training may have its place for particular individuals that don't really need as intensive an intervention, but may still meaningfully help them. And so we want to see, does it help them? And
Mhm.
then if it helps them, through what mechanisms, neural mechanisms, psychophysiological mechanisms, does that work?
Yeah, well, that makes sense. To conclude, I'm curious, do you have a kind of a micro skill or a go-to skill when it comes to emotion regulation that you would say you utilize in most situations?
That's a really good question. I'm trying to get more intentional about how I'm switching strategies.
Mhm.
Sometimes I don't want to distance. I want to do just the opposite. I want to immerse myself into a
Mhm.
more first person perspective, which sometimes you might want to do for savoring,
Mhm.
you know. Um, and then sometimes you want to, leverage distancing if it's kind of a little too much, it's too overwhelming at a given moment, and then switch to something else. There's very cool literature coming out, more thinking about just the extent to which you're switching these strategies. More so, that switching itself is associated with better emotional outcomes. And so I think that that's one factor for it. So I'm trying to become more intentional with the kind of my monitoring of it. I've asked people in my lab, since you've been in the lab, have you kind of recognized more, had an awareness of when you're using
Uh-huh.
particular strategies at particular times. And usually they say that they are. I don't think it's necessarily that, the notion isn't that we have to be burdened by thinking of what's the best strategy in every situation and kind of deliberating on that, but finding helpful patterns that may become more intuitive over time, including patterns for how to switch between one strategy and another as the situation unfolds. Um, so, but I guess if I have to say, I have found myself, I did use during COVID, I did use psychological distancing quite a bit because I really didn't know exactly when the end of it was. I did try to think of it as a natural
It's a
process.
natural process. Do you think, because it seems to me that what I'm hearing is that you definitely sort of practice what you preach, in the sense you think about um, which strategies to utilize and kind of actively, right?
We study what we have too much of or
Or
too
too
little of,
little of, yeah.
or too much of.
Do you think just the act of deliberating on it itself kind of puts on the brake in a way where it's that deliberation that kind of is adaptive?
Well, honestly, I think that is a really fascinating question because this is something else that we're really getting more interested in is the linguistic mechanisms of some
Mm-hmm.
of these things. And I think that, and there's a literature already on affective labeling and expressive writing and the notion of putting feelings into words
Mm-hmm.
and how that itself can be helpful.
Yeah.
And I think that that's really, really interesting. And what if you're putting feelings into words in, for reinterpretation or for distancing? Are there kind of linguistic signatures of using distancing, even if you don't know that you're using it? Can
Mm-hmm.
you analyze speech for kind of these latent patterns of emotion regulation strategies that people may be using?
Yeah.
And that's a direction that we're moving into in my lab. We've done a little bit on that with linguistic distancing, and I think that's another really interesting aspect to it. There is neurobiological evidence as well that when you put these feelings into words, you're bringing to bear some of this linguistic and cognitive control that is itself kind of helpful and anxiolytic in general. So I think thinking about how emotion regulation intersects with language and how we can use language in particular ways, maybe even in interventions that are more focused on that aspect itself or the expressive writing, or different kind of speech patterns that you could use, different self-talk that you could use, focused on more of the language itself, I think could be interesting, either from an experimental perspective of actually focusing on the language per se in an intervention, or another way that we're looking at it, which I think is also really interesting, which is just to naturalistically see how people are speaking and what that's associated with, vis-a-vis their emotion regulation and their stress and their health.
Uh-huh. That makes sense. I mean, putting things in language in general does seem like a way of either kind of naturally forcing one
Yeah.
to reappraise
Yeah.
or distance, right?
With
Because
distancing,
you're
yes.
intellectualizing this thing that was sort of so caught
Right.
within your emotions, and putting it into words does something
Yeah.
different to it. It makes us it once again gives us that break.
As part of mindfulness too. I mean, mindfulness is multifaceted, and that distancing aspect of it, I think, is crucial to it with describing something that you're experiencing and understanding it, not really with extrapolating how it's going to change or be different, but just it is what it is, and putting that into words what it is. And that itself can be helpful. And I think understanding the mechanisms of that are really, really interesting.
No, that's fascinating. Well, with that, this will conclude our interview. We thank you very much for being here, and we appreciate it. If you want to know more about Dr. Bryan Denny's work, where should people go?
You can go to our website at tscan.rice.edu, tscan.rice.edu, and love to hear from you. And Chris, thanks so much for doing this.
No, thank you.